from a surface level, having those AI capabilities to help clinicians with session notes or group notes, all of those are amazing. If you can improve efficiency, because I'll tell you right now, I've never met a clinician who got into any helping profession because they just love writing notes.
They love documentation. Documentation is amazing.
They said, can I do more documentation? What field can I do that in?
Welcome back to MasterMined. We're glad you're with us today. I'm Mark Scrivener, CEO of Snapshot, and with me, as always, are my co-hosts, Jeff Skillen, a trusted advisor and founder of Skillset Enterprises, and Lee Pepper, a sought-after behavioral health consultant and author of the new marketing book, Never Outmatched. Today, we're honored to have Kelly Scaggs, President and CEO of Fellowship Hall, a renowned nonprofit addiction treatment center in North Carolina. Kelly, welcome to the show. It's so great to have you on today. Really appreciate you being a part of MasterMined.
Thank you for having me. It was such an honor to be invited. I'm thrilled to be a part of it.
Great. Well, we'll jump right in if it's okay with you. You've been with Fellowship Hall since 2008. And now you serve as the first female president and CEO. What does that mean to you, Kelly?
Well, I'll tell you, it's really humbling to sit in this chair in this office at this point. When I joined Fellowship Hall in 2008, I came on as a family counselor I had no aspiration of leading the organization. I think I probably would have laughed if somebody had said that at that time for me, but having been with the organization now as long as I have and had opportunities presented to me and continue to grow in my role, I am just honored and humbled to have been chosen to fulfill this position when our last CEO retired. So it's been great.
You know, Kelly, first of all, I've been looking forward to this conversation for quite some time. I'm always fascinated when people start in sort of a counseling or therapist role, and then they make the shift into more of a leadership role. And some of my favorite leaders in this industry and some of the people that I look up to as mentors have bridged that divide. I'm curious how much of that informs how you approach the role of CEO now, and can we just dig a little bit more into that?
I'd be happy to. I have, as you pointed out, came from the clinical side, but also during my clinical work, I went back and got a master's degree in healthcare administration because my experience transitioning from the frontline clinical role into the clinical director role, a more administrative leadership role, was that there were gaps, I felt like, in my knowledge base, and I wanted to be able to balance both sides of the equation, so to speak, because there are so many skills from the clinical side that serve so well for leaders. And I think that's what you're seeing when you talk about those leaders who've bridged that. The empathy, the strong listening skills, the ability to make people or help people to feel seen and heard is so valuable in a leadership role. But there's also the reality of being able to read, P&L statements, being able to manage the financial health of an organization, the things that you don't naturally get taught in a clinical master's program. And so having both of those skill sets has served me well and been really helpful. But I do lean into those clinical skills on a daily basis because so much of leadership is people management and relationship management. And when your team feels valued, I think what they're able then to offer to your client population, your patients, we call them guests at Fellowship Hall, is critical. That's your product.
I always find it so interesting when I speak to someone with a C in their title, and then what you feel is like instantly you're like, oh, there's motivational interviewing present, or there's unconditional positive regard present. And I'm like, it is just such a game changer in terms of changing the temperature in the room. And a lot of people, I mean, obviously you're very skilled at it, but it's almost like a secret weapon. I mean, at least, I've seen it work that way. And of course you probably wouldn't wield it that way, but it's something really interesting that you can feel it in the room. Has that been your experience?
I think that is true. And what comes to mind for me is when we talk about, and I don't hear it quite as much anymore, but it was sort of a buzz term in the last 5 or 10 years about servant leadership. And I really feel like that's the distinguishing factor in leaders who bring that different energy that you're talking about, Jeff, into a room, is someone who has that servant leader's heart. And a lot of times I think the colleagues that I've encountered in these C positions at treatment facilities in particular, who have started in a frontline position of some sort before transitioning into the leadership role, whether it's at that organization or another treatment provider, bring a different element to the role. Because, I say there's nothing I wouldn't do here. And there's not a role that is above me or below me, I should say. I've been a frontline clinician. I come from that mindset. If I'm walking down the hall and there's a paper towel on the floor, I'm going to pick that up. If trash needs to be emptied, I'm going to pick it up. We do what needs to be done. And I think that's what sort of sets leaders in these roles apart from maybe other folks who didn't sort of have that front line, have done different roles within an organization. I think that is a distinguishing component.
Yeah, makes sense.
Yeah. Kelly, I think my clients that are set up as a nonprofit have a harder job managing their expectations of their board, because I feel like nonprofit boards are more diverse than some of the private companies' board of directors. And I was wondering, it must be a real advantage, though, for you coming from a family clinical background in trying to manage these boards' expectations. And I wonder if you might comment on that.
That is a fantastic question. The boards are very different. For instance, our board, as you said, is more diverse. It's also a volunteer board. And so these are folks running their own businesses. Some folks are retired on the board, but it definitely creates a different need to manage it slightly differently. I'm very fortunate to have a supportive board, but that's probably been one of the biggest learning curve pieces for me stepping into the president CEO role is working with the board, because essentially for us, our board's 14 members, and so you have 14 bosses, and they may have different expectations, and some folks have a lot of business experience, but maybe not in a nonprofit realm. So I feel like a lot of my role is helping to obviously drive my organization forward, helping the board to understand what the needs are, where the support is needed, what the vision for the organization is, and then balancing that with education around nonprofit and how they operate. Because if you don't have in-depth knowledge of nonprofits, it just shifts your decision making and how you envision the future of an organization and what role fundraising plays for nonprofits that isn't always a consideration in a for-profit entity. So there are a lot of components to manage.
Do you all have monthly board meetings or quarterly? Do you do annual retreats?
So we do quarterly board meetings, but we do monthly executive committee of the board meetings. So that's been a fairly recent change within the last couple of years, and that came about for a couple reasons. One was post-pandemic, because like most people, everything shifted to virtual. We'd always had monthly in-person board meetings for decades. And shifting that to virtual through the pandemic, one, allowed us to recognize the possibilities there, and then it also allowed us to expand when we search for board members. Because prior to that, we were pretty locked into our immediate area so people could come in person. So that has given us the opportunity to reach a little deeper into the community, a little further than the borders of our particular area to get quality board members. But we recognize there's a travel component and there's a time component for folks. So we made that shift of having the executive committee meetings every month and board meetings quarterly. And thus far, it's worked fairly well for us. But we're still within those first 2 years of making that change.
I'm really curious. I want to pick up on Lee's question here, because given the clinical background, do you actually do some family systems work, like as you approach these board meetings, or even as you're thinking about how you want to present certain things or initiatives and things like, it's like, do you dig back into that clinical bag of tricks and look at it more like a system or a family system? Or
are you saying, has she ever had to intervene on somebody at her board?
No, I mean,
because if I can get free therapy, I might want to join Kelly's board.
I was going to say, to Lee's question, I'm going to say no comment. To Jeff's question, I think for me, because I've been a clinician almost 35 years now, and when you asked the question, I started thinking, and I'm like, I know I do. I just don't do it intentionally.
Yeah,
it's not my conscious thought. It's kind of a natural thing that happens for me. I think I step into most situations like that, or at least I have family members who frequently say, stop therapizing me, which I don't think is an actual word.
Yeah.
But some of that skill set, you just can't help but bring into all interactions. But you're right. Recognizing how to navigate some challenges, particularly if there's something that I would like to move forward for the organization and obviously need board approval, I'm absolutely going to lean into some motivational interviewing. I'm going to lean into my family systems work to understand. It helps me to understand better the perspectives that individual board members may be bringing into the room as well. And we are an organization, obviously a treatment facility. We're founded on a 12-step philosophy. So a lot of our board members are also individuals in long-term recovery. So there's also language and components of the 12-step community that we can lean into some of those principles as well, and some of the decision making and some of the conversations, which is helpful to have that common language.
Yeah, Kelly, I want to go back to something you touched on earlier. It seems like you run Fellowship Hall like nothing is beneath you, and I love that. You serve with heart, and I know that we've talked a little bit about like mission, like you serve for the mission of Fellowship Hall. How is like mission alignment? How do you see that play out at Fellowship Hall, like day to day?
I appreciate that question a lot, Mark, because we are a very mission-driven organization, as many nonprofits are, but we talk about it constantly. We obviously have it hanging around our organization in multiple locations, and we really stay focused on that. And we'll have conversations in leadership team and staff meetings about how different decisions relate to the mission. Same with the board meetings, and staying focused on that to help guide us in our decision making, in our choices, in our vision for where the organization is going to go. And I was actually having a conversation with Jeff just before we started the podcast about the previous CEO who served in this role, Mike Yao. He had also been a clinician at Fellowship Hall and with the organization for over 30 years. And he said something to me, and I keep it in mind every day. He said, Kelly, just remember, this is just a place, and not getting so tied in or enmeshed in the idea. And I'm hearkening back to what you led with. Fellowship Hall doesn't exist because of me. It doesn't exist because of any staff member. It doesn't exist because of any individual board member. This is a collective. We exist because of that mission. And we need to keep that in mind, that Fellowship Hall has been around 54 years now. It was here, I would like to say before it was, I'm a little older than Fellowship Hall, but at any rate, Fellowship
Well, let's
Hall has been
explore
here
that,
a
Kelly.
long time. It's been here a long time. I was going to say it existed before I did, but existed before I came to the organization. It's going to exist after I go. And the same is true for all of us here at the organization. I think if we can keep that in mind and balance that against the mission, and that's what the lifeblood of the organization is, that's going to keep us on the right path.
Yeah, this is really fertile ground to kind of stay on, if you don't mind, because we hear from people that listen to this podcast, and we're very intentional about the guests that we bring on, from the idea of leadership, mentorship, that type of thing. And so I am confident there's someone out there that will hear this podcast who, they might be in their first job in this industry. They might also be a frontline counselor. They might be a tech, and they may not even know what the future holds for them. So I'm really curious, given your success and given what you've been able to navigate, what sort of advice or words would you give to someone who's maybe just starting and doesn't really know what is in front of them?
I'm going to share some advice someone shared with me. And it's very simple. They said, say yes. And say yes, especially to the things that scare you. And I think there's so much wisdom in that, because opportunities come to us. And I think as human beings, for a lot of people, not all people, the first instinct, especially if there's a little anxiety or fear around something, is to say no, or to think, I can't do it. But you know what? That opportunity would not have been brought to you if somebody didn't see something in you. And say yes, leap. Just leap. And that's a scary thing to do. It was scary for me. There are many times that I have said yes when every fiber of my being wanted to say, no way. Mm-hmm. I'm in over my head. I don't have the skill set. I don't know that I can do. We could go through a million reasons to say no, but say yes. And
Great
take the
advice.
opportunities. If you're given an opportunity for training, if you're given an opportunity to take on a project, say yes.
Yeah, I love that.
I think that's great. And I wrote that down because I want to talk to you afterwards, Kelly. I think that's a book. You have a book in you there. We're going to title it Say Yes.
There you go.
And, to echo that, I think a lot of people, when they're new in their careers or they get a promotion, I think they get worried about what the C-suite's going to think of them or what the board's going to think of them. But I always try to educate them from my perspective that nobody is cheering harder for you than your bosses, than your board of directors. And sometimes that gets lost because we're worried about failure or the imposter syndrome. And I wonder if you might, because your role has been really fascinating, and especially, how do we put that kind of attitude into our young women that are coming up in this field? Because, we have been dominated for years, by, Caucasian males. And that's one of the things I was really proud at Foundations, that we had a lot of strong women, Paige Bottom and Krista Gilbert and Kathleen Bigsby and Jennifer Angier, that were senior leaders at our company. And I wonder, how do we kind of inspire this next generation of young women to kind of say yes?
That's a great question. And I love that we're even talking about it or thinking about it, because for all the talk that happens in the world about who gets promoted and things like that, I think that people getting to see other people in those type of positions, that representation, seeing someone, another female, those strong leaders that you already referenced, those things are really important, giving opportunities to folks. We talked about who cheers folks on when they get promotions. I think if we can start to instill in folks that message, as well as you can be your own biggest cheerleader. You really can. And it goes to some of that therapy talk of external, internal locus of control, and how you feel like the world operates and you fit into it. But I think being able to see folks like yourself in some of these leadership roles is really important. And ask, it's okay. People love to be asked. If someone comes up to me newer in the field and says, hey, I think I want to be a leader one day. How do you do that? I love to share. I mean, nobody that I've met in a leadership role is proprietary about their path or their information. I think sometimes people are afraid to ask. Again, ask. Another thing someone said once early on that I've latched onto, if you get an opportunity, if a door opens for you in some way, it is your responsibility to reach back and take the hands of two others and bring them through the door with you. And so for me, I think of it in terms as a female in a traditionally male-dominated field, which, to your point, it has been, Lee. I feel like my responsibility is to give opportunity to at least two other women as we go, as we grow and move, at least to look around and say, are there other people who are bringing a talent that might have been overlooked? Let's bring them along with us.
Yeah, we can practice that now. We don't have to wait to become CEO to practice it.
Yep.
We can practice it as a team lead, as a manager, as a director.
Yeah.
Absolutely.
Kelly, such great advice. And I mean, with every great leader, there's definitely going to be many people that help them along the way, like you talked about. Who have been some of those people maybe in your trajectory that have helped get you where you're at today?
Let me think. I've thought a little bit about that because there were folks that I think have helped me and they don't even necessarily realize it. Mm-hmm. And even as we're talking about it here, I'm mentally making a list of folks that I want to be intentional to let them know that. Because I don't, a lot of folks that I've observed in action and I thought, wow, that's impressive. I want to be like that individual, or I want to be sure I lead in that way. There's a female CEO. Some of you may know Kathy Tully or Kathy Palm, at Tully Hill,
Yep.
New York, and she was one of the first female CEOs in this space that I became aware of, because there weren't and still aren't a tremendous amount of CEOs that are women in this particular industry. It's growing, but it's still predominantly men in the C-suite positions. So seeing a woman lead with confidence, seem to lead without fear. I'm sure Kathy had some, but just to be kind of a powerhouse in that space, to see it made me think, just as we were talking about, oh, that could be a reality. Somebody like me could step into a lead role like that of an organization. So, another person that I've had the opportunity to watch more up close lately has been Jamie Vink at the Meadows.
Yep.
I serve on the NATAP board with her, and getting to see some of these women in similar roles who've been in it much longer with great success, doing amazing things. Speaking of books, Lee, she just released a book. And on this particular industry, on the rehab industry. So getting to see some of these women and what they've accomplished and achieved motivates and inspires me. So, those are probably two that immediately come to mind, but there have been so many along the way. And you know what? There have been a lot of, I want to give credit to, there have been a lot of men along the way that have served in de facto mentorship roles for me and been encouraging and been cheerleading for me. And I think sometimes that folks don't always recognize that. We've kind of talk about, if the industry's been dominated by Caucasian men and all, and it's also been, a lot of folks in those roles who've been the ones lifting individuals like myself up. And so I want to recognize that as well.
So Kelly, let's get to practicality here. So how do you actually manifest that gratitude? So do you actually text these people? Do you handwrite notes to them? How do you actually acknowledge that? And I'm curious because part of what I would like to do is that I agree 100% with what you're saying, is that there are so many people that have helped us along the way to get to where we are. and I don't think they even realized the role that they played. So I'm curious, like, and I'm thinking more about for the listeners of this podcast in terms of what is meaningful to people. What is it you do and what has affected you? So what do you do to acknowledge it? And then what have you received that was meaningful to you? So we'll know what touches people.
For me, I love a good handwritten note. I was raised by a good Southern mother, and all about the handwritten thank you notes. But I do enjoy a handwritten note. So I try to, in all of my leadership positions, I've tried to acknowledge teammates, thank people above me. If I've been given opportunities, I like to do a handwritten note. But I think this is another place where leaning into some of the therapy experience is useful, because how I want to be acknowledged may not be how somebody else wants to be acknowledged. And if we can pay attention and kind of listen to what's meaningful for other people. I learned that lesson really early in a staff meeting. I acknowledged someone's birthday in a treatment team meeting, and thinking, I would love that. I mean, throw me a parade. I'm excited. It mortified that person. Some of us love the spotlight, some do not. And it was a really good lesson for me in leadership, is paying attention to how people like to be recognized. So I ask that in onboarding, when someone's onboarding with the organization, I ask how they like to receive feedback, how they like to be recognized, because that's important as well. I love it. I love to receive a handwritten note or letter. I'm a little embarrassed to admit it, but I'm about to tell you, throughout my career, every handwritten note or card or letter I've gotten like that from a former client, from a teammate, I still have them. I save them. We all have those days at work where, well, I shouldn't assume we all do. I have days sometimes where I think, am I making a difference? Should I even be here? Should I be doing a completely different job? The days that you're just a little not feeling it. You don't feel like you're making that difference.
Yep.
It's nice to be able to pull some of that out and, give myself a little mental boost and remind myself that, I have made a difference.
Jeff, I'm so glad you asked that question. That is just great. I think I see a couple handwritten notes going out today, Kelly, from you to those folks that really got you where you're at today or made an impact on your journey.
I'm going to recommend, this is something that I've done, and because I recognize that there have been times where I've wanted to acknowledge someone and I've been like, they're not going to want to hear from me. And so I actually have a Post-it note on my monitor in my office that says, "Send that text, send that note." And I know what. Not only do you hope that someone is grateful to receive it, but it does something for you too, where you're actually sending that out to them, and you're recognizing the gift that they've given you. So I thank you for being vulnerable on that. I just think it's important that people realize the impact that it has.
I think for young up and coming leaders, what Kelly just said is so important.
I completely agree.
I think it's a lost art, like you said, Kelly.
And it just perpetuates
I think
that
so.
behavior.
And to Jeff's point, it does something for the sender of the message as well, because you can't be grateful and anxious at the same time. So if you are your brain just can't do both. If you are having a bad day and you sit down to write that note and you switch your mindset into gratitude, you're going to have a better day. And so it can be a text or an email.
So much of this circles back to a therapeutic approach of, a lot of the things that we've already talked about is like, you've got to let go one rope to grab a new rope, and it's like to walk through that door that's open for you, and then to carry two people along with you. And it just feels so good.
Well, Jeff, if my name is on your Post-it note, just know you can send me that text anytime. And Kelly, you're going to get a handwritten note, and if you can't read it, it's from me, because my mom always says I write like a pharmacist. So I'll try to sign it so you'll know it says Lee Pepper, but you probably won't be able to read any of the text.
No.
Well, they used to say if you have a poor handwriting, you should become a doctor.
Well, I know,
Maybe
but
Mr.
Dr.
Crowley.
Pepper, come on, that was not in the cards for me.
I did not think about that. You're right.
I mean, Lee, every time I sign you up for junk mailing list, I mean,
That's how
you get the Dr. Pepper all the time.
Oh my goodness. Oh my goodness. And I think, Kelly, what's so nice about you saying that is I think people sometimes are waiting for permission. And I think what you're saying is,
Yes.
let's don't wait, let's do it. And I think sometimes people don't know what to do. And so I really think it's helpful for people to hear that, no, you can write the letter. You can text, like Jeff was saying. I think sometimes we're worried that people will be offended, or she's the CEO, she's busy. And I think it's great to hear you say that, no, you're not too busy. You saved them. I mean, that's amazing.
Yeah, and you know what? What's the worst that's going to happen? If you send that appreciation note or, hey, it doesn't even have to be that. I was thinking about you today.
Right.
Yeah.
I heard, you sent your youngest to college. Hope you're doing okay. Whatever it might be that acknowledges somebody, makes them feel seen. If they throw it in the trash and it means nothing to them, no harm. You
Yeah.
you haven't harmed anybody.
Yeah, and I mean, this just, of course we talk about business, and of course, that's the nature of the podcast, but this is a people business. And at the end of the day, a thread that goes through most of the episodes that we have is people referring to people, people treating people, and then people getting better and living powerful lives. I mean, that's really what this boils down to. And I've got to think that that's a reason that all of us are in it. So I'm curious, I mean, Kelly, on those days that are difficult for you, what keeps you motivated? What is it that keeps you going and reminds you of a bigger purpose?
Well, it kind of goes back to the mission of the organization. And I'll tell you, this is something I've told folks for years in every position that I've held in this organization, really just in the helping profession in general. Having a front row seat for the miracle of recovery is the best part of my job. I mean, if you think about it, I'm fortunate. My office is at the front of our building, so I'm right by the lobby. I see folks come in pretty terrible shape sometimes. I mean, they may be so deconditioned they can't even walk. And, I find out this is somebody who's 45 years old and they look 65 years old. And then I get to see this person over the next however many weeks they may be with us, and they are aging backwards. Their smile comes back, the light in their eyes, they're walking around. Next thing I know, they're playing volleyball. I mean, these are amazing things to see. And being in the family department, seeing families come back together, it's incredible. And you're right about it being a people industry, because if you think about it, our product is product, if there's not really a better word.
I was going to say, do you feel comfortable using the word product, Kelly?
Not really. I just don't have a better one.
Right.
But, the service that we're offering, it's not tangible in the sense that I can hand you, a widget we made and say, look, we made 500 of these this month. No, we're impacting people's lives, and it is delivering something to them or providing them with skills, helping to give families skills to move forward that you can't touch and feel that, but we get to witness it. And I think that is what keeps me going and inspires me when it may be a bad day. Because, I mean, we're in an industry, every day is not great. This is a disease that's killing people. But then you remember, or for me, I have a note maybe from somebody who said, I came to Fellowship Hall 5 years ago, and I've since completed my degree, started my own business, gotten married. I mean, these are real life stories of real people's successes, and that, I mean, gosh, if something's going to make you get out of bed and go to work the next day, that's it.
Well, Kelly, I wanted to shift gears just a little bit and ask you some questions around the industry, and I'd love for you to explain to our audience that being a nonprofit doesn't mean that that you guys have an easier path to dealing with payers. And so I wonder if you might...
I wish that were true.
I know, don't we all? But I wonder, what are you seeing on the payer trends right now? Are we still having issues with UR? Are we still seeing pay to patient affecting some of our states from your perspective?
Yes, I know that we have providers in our state that are out of network with several of the commercial insurance companies, and we are seeing we're in network, but for those providers that are not, that payment is going directly to the patient. And that is a challenge. One, they're chasing folks to get that money. Two, I mean, if you think about it from a practical standpoint, somebody has just completed treatment for substance use disorder. They may have maybe 30 days when a big check arrives. That's risky.
It's unconscionable that's allowed to continue.
And one of the other challenges that we're facing, Lee, are, at least in our state right now, are insurance companies wanting pre-authorization, which is not necessarily unusual, but the delays in getting that. So if someone comes in, for instance, fellowship hall, and they enter at a detox level of treatment, great. So 5 to 7 days, typically, they're going to step down to the residential level of care. Well, if you're putting in for a pre-authorization and then you have to wait potentially 10 business days to get a response from an insurance company, and the response is a denial, now this person has had 10 days of treatment. We're not getting paid for it. We can't ask them to pay for it because they have their insurance. So, these are the challenges that are coming up, and the commercial insurance really holds all the cards.
Yeah. Kelly, I know the treatment landscape is changing very quickly. Like, what trends are you all keeping track of right now? Like, what are you watching out for?
The one that I am focused on at the moment is the AI piece of it, and what an impact it's already having and is going to continue to have. Because from a surface level, having those AI capabilities to help clinicians with session notes or group notes, all of those are amazing. If you can improve efficiency, because I'll tell you right now, I've never met a clinician who got into any helping profession because they just love writing notes.
They love documentation. Documentation is amazing.
They said, can I do more documentation? What field can I do that in?
Right.
They may exist. I haven't met them.
Right.
So to be able to streamline, not necessarily write the note form. I think we get in dangerous territory if it's writing the note, but helping craft it, or giving a framework certainly cuts down on that time spent. I think it's going to help on the UR side. I think there's so many amazing things that are going to happen with this technology, and then we also have to balance that with how does that play into HIPAA protections? Where does this information live? Is it stored? So there's that side of the coin as well that has to be addressed. So it's developing and changing so rapidly that's where my focus is, on how can we use this ethically and to the benefit of the staff, because I think it could help with our workforce issues that the whole industry is facing if we can do things that are going to minimize burnout potential. So I think it all works together.
Kelly, up until now, this conversation we've talked about, past to present, and now we're sort of moving into kind of the future. And you mentioned AI, and we've done several episodes on AI and from different angles of how it's approaching the industry. And it's such a big topic. I'm sure we'll do more, right? I'm also thinking about policy, and I'm thinking about where that landscape is going. And you're in a unique seat, not only CEO, but your involvement with NATAP and other boards and industry groups. Look into your crystal ball, and where should we be putting our industry? Where should we be marshaling industry forces for the next few years? And where do you see hope, basically? So like, where do you think we should play offense, and where do you think we need to play defense?
I think, I do feel hope. I think a lot of times it's easy to lose sight of there's a lot to be hopeful about. As an industry, we're still making such a difference because substance use hasn't decreased, unfortunately. There have been shifts in our industry. The pandemic was, something we're still dealing with the residual impact of. But the changes that we're seeing, I think that the challenge right now is things are happening at such a rapid fire, and a lot of shifting that it's hard to adjust for it. We're fortunate as an organization not to be in a position where we are necessarily serving like a Medicaid population where those changes are happening real rapidly for those providers. But changes are happening in the commercial insurance landscape, how treatment's provided, what's provided, how harm reduction fits into that puzzle right now. How do peer support specialists fit in? Are they going to be funded? Are insurance providers going to recognize their role? How is it going to be recognized? So there are so many components to it. I think our greatest strength as an industry is in general that we collaborate. And I have not been in too many industries where there's a genuine collaboration. There's competition, of course, but as an industry, as a whole, I think we collaborate well. There, unfortunately, are more people who need our services than there are beds in this country, believe it or not. We know not that many, beds at treatment facilities. Not that many people who need it actually are able to access it, but we don't have to compete against one another for that patient population. And I think that if we can come together and collaborate as one entity, and I know you talked about on the previous podcast with Nikki Soda that coming together and lobbying for some change, looking at accessibility of treatment for all folks in our country. These are the type of issues that if we can come together and have one unified voice on, we can make some real difference and change. And it's people that are on that policy side and have a passion for it, like Nikki, that I think can help lead the way with some of that. And then those of us who maybe are connected in other organizations can carry the message and help bring folks into the fold. I think that's what's going to make a difference.
So it sounds to me like we can count on you to be part of the movement, right?
I would love to. And I don't consider myself as much of a macro type clinician, so to speak, but in the CEO role, that's a requirement. And I loved what you all were saying, and I think it was you, Lee, in the last podcast where you were talking about politics on a local level and how I think I'm crediting it to the right panelist here, but that we all need to get involved and how critical that is. And it really gave me some food for thought. We are involved and connected with our local and state legislature, but there's always room to improve on that, get more involved, get more active in that. And so that was one of the takeaways that I had from that discussion is, I want to step even deeper into that.
Do you think by being a leader of a nonprofit, does that give you more credibility in that space? Just curious what your take is on that.
I'm not sure, honestly, Jeff. I would like to think so, but I'm honestly not sure how. I think being part of a legacy organization probably gives me more credibility than the for-profit versus nonprofit angle. The fact that my organization was the first licensed specialty hospital in my state, I think lends a little more credence to the message that we carry than maybe someone who's newer in the market. That may or may not be fair, but I do think that's the reality.
Well, Kelly, I'm glad you brought that up because, I live that all politics is local. We just had our 10-year Veteran Treatment Court anniversary on Monday, and I was so pleased to see that we had some of our local aldermen and our county mayor, Rogers Anderson, was there. And it's like, we always have, representatives from the state, and we'll usually have somebody from one of our senators, and we always have our congressional representative's office there. But sometimes we forget the really local people, and if it starts there, it kind of starts to bubble up. And I think that's one of the things that we did with Cumberland Heights and with Discovery Place. We brought groups of people that they had not really, reached out to in the past. We brought them in so they could start to learn about the programs at a very local level.
Yeah, we. Lee, you'll relate to this. We used to have a joke that it's not hard to get state and national politicians involved, especially if you got good news that you're talking about. We used to joke that they'll show up for ribbon cutting. Heck, they'll even show up for a refrigerator opening.
Right. They say yes.
But the reality of it is those are the people that are not going to actually make a difference in your business and then what you're wanting to operate. It's going to be much closer to where you operate, and it's not sexy work.
Yeah.
But it's so important.
I'm going to steal the refrigerator opening. That's amazing.
It goes back to saying yes to opportunities and going to events like you were talking about, where you are going to meet people that maybe you didn't think could help impact your organization. So, and again, we had the conversation that this is a people business, and people refer to people, not necessarily organizations. And so
100%.
I take every opportunity for a conversation or to go to an event. And a board member actually recommended that as an organization that we join the National or the North Carolina Hospital Association, which is actually the Healthcare Association. Wasn't something that, we had stepped into before. And that's been incredible. One, because we have access to some of the conversations happening at our state legislative level that impact healthcare providers that we might not have otherwise been a part of those conversations, but just the connections you make. And again, it's saying yes.
Yeah,
It's
Kelly,
critical.
for a newer leader out there in the nonprofit program space that's listening to the podcast today, what's like one thing that you would share with them that they can do this year to maybe strengthen their organization?
I would say a great thing to do for a newer nonprofit leader is visit other nonprofit providers in their space, and some for-profit providers, I think, would be helpful, because seeing what other people are doing. I don't know that there are many original ideas left in the world, but what I find is a great spark for ideas is to see how other people are doing things. And it gets you thinking about, would that work in my organization? Or that's interesting how they do that. That's so different than how we do it. And it kind of gets the thought process flowing. And I think that's what is really important for newer leaders, is how are you going to vision the future of your organization? Because so much of leadership is honoring the past of where it's been, caring for where we are in the present, and then shaping what the future is going to be. So you've got to hold all three of those at the same time. And the one that I think challenges newer leaders more than any of those is shaping that future. What's that future going to look like? And you're not in it alone. You don't have to do it alone. You've got to ask for that help, make those connections, go visit other organizations doing the same or similar things to what you're doing. And I think that you'll feel encouraged, supported, and leave with a lot of creative thoughts that'll lead you to shaping that future.
I love that response, and then I'm gonna approach it from sort of the other side of it. As you're thinking about board members, investors, stakeholders who really want to support the mission, what advice would you give them in terms of how to support an organization and how to support the leadership of an organization so that they could be effective and so that they can really carry out the mission?
I think if you're going to serve on a board, really have an understanding of the mission of that organization. And if you don't, immediately educate yourself, ask people, spend some time learning about the mission and the passion of that organization to make sure you're in alignment with it, because that's who's most effective. And then carry that message and your understanding out into your community, because that's where the benefit comes, whether it's from a fundraising standpoint, which is huge in the nonprofit world. Every decision's a mission decision, and you've got to have the fundraising for nonprofits to help make up some of that gap that occurs just naturally being a nonprofit. And board members can be helpful in that, staff members can be helpful in that, but carrying that message out, and because not everybody's in the position that they're going to write big checks to an organization, but you can be a huge supporter of an organization without having to necessarily write a big check. If you want to write a big check, that's always great and always appreciated, but you know what? People's time, volunteering their time, supporting the mission by telling the story, coming out and helping with events. All of these things support an organization. And you may not be that person who writes a big check, but you might know someone who, if they really understood the mission of the organization, would be willing to support or able to support financially.
Well, Kelly, as we're kind of wrapping up the podcast, I wanted to give you an opportunity to maybe explain to our listeners a little bit about Fellowship Hall, and love for you to give your elevator pitch and talk a little bit about the levels of care and the locations.
Thank you. I appreciate that opportunity. As I mentioned, Fellowship Hall has been around since 1971, so we're 54 years this year in
Congratulations.
existence. Thank you. And we are a treatment facility for substance use disorder with secondary co-occurring disorder, because very rarely is there not another issue at play for most folks. And we have the full continuum of care, from detox to traditional outpatient services. The continuum for us is most people come in at a detox or residential level, but we also have a partial hospitalization program for folks who want to commute. If you don't live in the area and didn't want to commute, we have some structured sober living available on our campus as well. And we're so blessed to have a 120-acre campus right in the center of North Carolina. We're in Greensboro, North Carolina. So we're accessible. We have a major airport here, as I said, right in the middle of the state, in a beautiful location, beautiful rolling hills, just a nice atmosphere for folks to be in. I think sometimes when people think about treatment, they think it's going to be like One Flew Over the Cuckoo's Nest. They're going to be in a building with bars in the windows, and this is more like visiting a college campus. And with our team being so mission driven, we want to see people get well. And that's something that I love about Fellowship Hall, is that if someone were to call us and need care and we weren't the right fit, we're going to connect them with the organization that is a right fit. Because if it's not us, maybe it's Cumberland Heights, as you all have mentioned them. We'll connect them.
What's the history of that property that you're on?
So it's interesting. Our founders were 4 members of Alcoholics Anonymous that were also prominent businessmen in the Greensboro area. And in the late 60s, they were working with a young man struggling with alcoholism, and they couldn't find somewhere to send him to treatment. Remember, post or pre-internet, it was a little harder to find places to send people. And unfortunately, the young man passed away, and they said they never wanted to see another person die from this disease. So they started looking for property, and they found a working farm. At that time, it was kind of on the outskirts of Greensboro. It was about 40 acres when they purchased it, and it has. We purchased the surrounding property over the years to grow it to about 120 acres out here. But
Excellent.
When it first started, we had herds of cattle on property, grew all the vegetables. So actually, the guests in treatment, the food that they consumed was right here off the land. So
Excellent.
It's got a great history.
And I guess people in the area, you guys are open to giving tours, or anybody who's interested?
We are happy to give a tour. We love to show off the organization. As you can tell, I'm happy to go on and talk about it. But we have an incredible outreach team as well. They're happy to tour folks. We're happy to partner with businesses too, to be able to provide services to their employees. We are in a part of the state that is rapidly growing as an aviation hub. Here in Greensboro, we have Honda Jet, and Jet Zero's just started breaking ground to build a big facility here in North Carolina. So safety-sensitive positions, those folks need additional care and monitoring if they struggle with substance use disorders. So we're able to provide to safety-sensitive professions, whether it's physicians, attorneys, folks in the aviation industry. So, we want to be a resource for other industries as well.
Kelly, what is, kind of looking forward, what is next for Fellowship Hall? Like, what has got you the most excited about the future?
I want to see us continue to be able to develop how we serve the population we serve, because it is a niche, substance use disorder, but I think as healthcare is starting to evolve, one of the things we're seeing is that folks are not going to go to an organization like Fellowship Hall just for their substance use disorder. It's going to be more of an integrated system of care. And to that end, we've recently added support for folks who struggle with disordered eating patterns. And, we're treating other co-occurring disorders, but starting to provide a more integrated healthcare environment, I think, is the future for most providers of care, and where folks are going to go and they're going to get a lot more of their needs met in one location. And I think that's what we're going to start to see a transition in the healthcare industry, and already are seeing.
Well, Kelly, it's been fantastic having you as a guest, and you've brought a lot of great wisdom and energy to this conversation. Is there anything that you'd like to share that we haven't talked about?
I think we've covered so much ground, but I would like to say, if there are new leaders or leaders who've been in a long time that want to connect, again, I'm always happy to connect. Someone can reach out to me through the organization, email me, however they want to get in contact. If I can be of service to somebody else, there were so many people that were available to me to lean into and ask questions or get advice from, that I want to be sure that I give back what was freely given to me. So I would just put the invitation out there that I'm open.
Great. Well, thank you, Kelly. We'll put all your information in the show notes for everybody listening to the show. So thanks for being a part of MasterMined today, and thanks for being on the show. Really appreciate it.
Thank you, all of you. Thank you for the invitation and another opportunity to say yes. Thank you.
Love it. Thanks, Kelly.
Thank you.
Excellent. Thank you.
That wraps up this episode of MasterMined. Thank you so much for joining us. And remember, MasterMined is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on MasterMined, your behavioral health playbook.